Health, they say, is wealth, but health without knowledge has become something else. You know, concerning COVID-19, are we in post-COVID-19 era? There are several opinions on the street about COVID-19. Why some people are no longer using nose mask, saying, "Oh, COVID-19 is over." You know, what about the vaccinations? Where can it be, when can we get it here in Osut? What about it? Why are some people not receiving it? Why are some people getting it? You know, so Dr. Mrs. Ebonlua Jaisimi from the CMPC of Osut will shed more light on this. Stay tuned.
My name is Dr. Ebonlua Jaisimi. I'm a community health and primary care consultant. I work in Olabisi Onabanjo University Teaching Hospital as a consultant in the Department of Community Medicine and Primary Care. I'm also a public health specialist. The disease COVID-19 was first detected in the year 2019, precisely December. It started in China and then it migrated. It's caused by a virus that is called SARS-CoV, that is from the SARS family, and is referred to as the SARS-CoV-2 subtype virus. The first cases of the disease was in a city called Wuhan in China, and that month of December was when it was first detected in that part of the world, even though there might have been some cases that were not noticeable. But as by the month of February, by February 2020, Nigeria's first case was confirmed, and then WHO declared it an emergency. As of today, statistics in Nigeria says that we have 1,912,628 people tested for the virus, and 164,993 are confirmed as positive. Those who are actively, still infected is about 8,000. It's actually precisely 7,909 in number. And the number that has been discharged so far is 155,021. We've recorded over 2,000 deaths, 2,063 deaths as of today in Nigeria. For us in Ogun State, the number of confirmed cases is 4,664 as of today. And the number that have been discharged from, haven't been treated and they are okay is 4,573. We've recorded 49 deaths, and we have 42 that are still on admission for treatment.
COVID-19 it's a virus actually, and it has really disturbed many lives. Since last year, I've been at home and there was nothing to do and everything. Anyway, it's been a very big distraction.
But Ọlọ́run ló ń dáàbò bò yàn. Even gan kíní tán lò yẹn gan ó kó bẹ́ẹ̀ lòmíì. Torí ẹlòmíì ò mí délẹ̀ dáadáa. Àwọn èèyàn tó ti fẹ́ǹtì lójú mi. So anything tó bá ti nígbàgbọ́ nú Ọlọ́run kò sí nǹkan kan tó lè ṣe.
When you talk about vaccine, actually, this is not the first time we were talking about vaccine or we're receiving vaccine in Nigeria, not only in Nigeria, all over the world. Vaccine has been known to be useful in preventing diseases, especially those that are of public health importance, that is, that affects more than 5% of the population. So for COVID,
Màá gbà tí n bá rí, màá gbà fáwọn èèyàn mi náà. Àwọn èèyàn mi náà á gbà. Mo mọ nǹkan mi ti ẹ̀gbọ́n àfi bẹ́ẹ̀ ṣe ń sọ yìí o but tán bá gbẹ́rú ẹ̀wà mi ò lè bá wọn gbà ọmọ mi ò lè gbà o because Ọlọ́run ló ń tọ́jú àwa kò ń ṣe ìjọba COVID-19 àrùn íjíbítì ìgbà kan ni.
There are different types of vaccine that has been formulated for the purpose of preventing this disease from going around. From what we have seen, the statistics I gave you, it's a highly infectious disease, easily transmittable, and for that reason, best bet is for us to be vaccinated to prevent it. So there are different types of vaccines for COVID. There's the whole virus vaccine. That one is produced from weakened virus. There's the mRNA vaccine, which is mRNA molecules that are made in the lab, which codes for the COVID-19 spike proteins so that the body can react to them and then produce immunity. There's also the non-replicating viral vector vaccine, which is a modified version of that virus. We also call that a vector somehow. An example of that is the AstraZeneca vaccine, which we are receiving and we took in Nigeria, and we're still going to continue to take. The last type of vaccine is the protein subunit vaccine. So for this virus, the way they work actually is that all they do is that they produce in us memory T and B lymphocytes, which in a layman's language are like soldiers in your body that wants to fight invaders. The COVID virus is the invader. So once you get the vaccine, it makes your body cells to respond and produce these soldiers that we're talking about. And these soldiers are like memory soldiers that are, they are produced in the body, so that after the vaccination, if anything that looks like COVID virus comes into the body again, these ones will stand up to it and fight the infection off. So that's what the vaccine does. But it seems like there's so many other kind of information that community out there have received about vaccines. We all know about the conspiracy theories. It's going to make you grow horns. It's going to prevent you from entering heaven. You probably become a slave to the beast and the rest of it. But looking at the science of it, there's nothing like that. So once you take the once you take the vaccine, you are protected, but not with one shot. You are supposed to take, for the different types, there are different numbers that you need to take. But the one we're taking in Nigeria, you will only be taking 2 shots. The first one and then the second one, some weeks intervals to each other. And I think that's just about it. The other thing that we've heard people talk about around the vaccine is the reaction that people get from it. Some people reacted, and that is also not new. If we remember quite well, especially those of us that are mothers, when our children, our babies, get vaccinated for the common childhood diseases like the BCG, which is to fight TB, like the polio virus, the diphtheria virus, the tetanus virus. Some of those children react by having fever, but it doesn't kill them. So long as you know what to do once that reaction comes up. So when people have reaction, some that I have heard people reported were things like fever, mild fever, some things that would look like you are infected with the virus itself, but it does not do you anything. It will wane off after some time, resting, taking lots of fluid, probably taking your vitamins. By the time you do all that, it will go off. We've also had situations where people have thrombosis or thromboembolism, which we have heard from. But that also is treatable. It's treatable once it happens, but it's also very rare, at least amongst us, the Nigerians. Well, I've not heard so much about thromboembolism as a result of the vaccines. It might be happening and I'm not aware of, but at least so far in my own center, which is the teaching hospital, we've given several people, because our center is, hospital is one of the centers where you can come and take the vaccines. We've not had reports of serious side effects. Once you've taken the one that is available in Nigeria, you really do not have to take any other one. The one we're taking here is as good as the ones that are taken in other places, like the Pfizer's one that is being taken in some other places. And the issue of once you've taken it, you are protected for life is also not yet clear, because this virus itself is new. That's why they call it an emerging disease. And there's also, for that reason, people are still watching. So once you have taken the vaccination, you still need to make sure that you are observing all the other protocols, all the other modes of prevention that we've been talking about: social distancing, not being in crowded places, wearing your mask all of the time, ensuring also that when you want to cough, you cough into your elbow, you sneeze into your elbow, you protect others by masking up. All those things we still have to, and continue to also observe our hand washing regularly. We still need to do that. It's more, number one, because the first vaccination does not confer total immunity on you. The second one, even if it does not mean it is for life. It is still under study. So for that reason, we still need to observe all the other things that we used to do when we didn't have the vaccine, until we're sure that this is it. So that's the exercise of the vaccine is, first, at least protect yourself for that short period. And what if at the end of the day we find out it does confer long life immunity, life immunity on people? For the importance of it is that once you have taken it, you are protected. If you also take it, if I take it, I'm protected. You take it, you are protected. All of us are taking it, and then we are all, at least for that period, protected. So our risk of infection reduces. There's something that is called herd immunity. When an infection is up to the level where almost everybody is protected against it, then we record less number of active cases. We also record less number of death if it is a disease that can cause death, like COVID-19. That is, for me, is important, because yes, maybe the death from COVID-19 is not as much as the death from other diseases, which some people claim. Yes, agreed. But if we allow it to continue and we don't nip it in the bud, there's the likelihood that it will also become a Mongol like those other ones. So that's why, for me, I think vaccination is important. So for you to get the vaccine, it's free. You don't pay anything. But you will need to register online for the vaccine. Once you register, you are given a number. The number that you are given is what you will present with in the place where they are going to vaccinate you. And then they record it. They have their records. They put it on a card for you. They give you the vaccine. They give you an appointment day for the second dose. And they give you your card to go away with. Just like we do for yellow fever that people carry around when they are traveling abroad. So you do not have to pay anything. And centers, primary health centers, the teaching hospital are places where you can always get the vaccine, you know. Even if you get to a primary health center and they are not amongst the centers that are, you know, allocated vaccination number, they will refer you to the ones that have the opportunity that are delegated for that kind of service, and that way we all would have access to it. But teaching hospital here has two centers within the hospital that could, two groups of people that are, you know, vaccinating people. The community health and primary care departments, that is our nursing units, which is by the gates, the out gates for OUTH. When you get there, just ask and tell them you want the COVID-19 vaccine. For now, it's not ongoing. It's in batches. It's being released in batches. We've just finished the first batch, which were mainly meant for the frontliners, that is those that are working in high-risk places when it comes to COVID disease. Then the next batch is coming soon. Training had already been done for those who are going to be vaccinating people, and we're expecting the batch of those vaccines. Once they come in, I'm sure there will be information within the community through community mobilizers, town criers, maybe on the radios through remote TV too, so that everybody can have access, at least those that are designated at that time to take the vaccines. Read or told us about the situation in terms of statistics. We still have in our own states 43 people that are on admission, which means we still have active cases. In Nigeria, we have 7,909 people that are we are not yet in post-COVID era. We're still in COVID era. All we are trying to do is make sure we protect ourselves. We are so blessed that we are not dying in thousands and in millions like it affected other nations. But we should not take it for granted. God be with us.